Patients will very often complain of pain in and around the knee and not have any idea of the weakness that is part of the process. The most common weakness in knee pain that I see is related to the popliteus. The popliteus is a small muscle that sits behind the knee and runs across, and what it does is it supports the knee in the extended position and resists it from externally rotating. And so that's how that's tested. So the knee's bent, the heel, the foot is elevated and rotated inward. The lateral side is stabilized with one hand, and the inside of the hand grasps the other part of the foot. But you're really coming around to the way back of the foot. So you're holding the foot, not the forefoot, but the rear part and even the ankle. You want that to move in one complex. So you stabilize here, then you start to rotate out while the patient resists. Now what happens in a normal muscle test is you can usually get it to right there, and then that's the end of it. And so you get to pretty much a neutral rectus position right here, and then that is the end of the normal range, and you'll feel the resistance. When the muscle test is positive for weakness, just relax, Terry, then what happens is when you rotate it, it'll turn way out like that. The manipulation for this is amazingly simple in general. The only precaution is to make sure that there is no draw sign in the knee and that the knee itself is stable, and we know from Terry from before that that's the case. So what happens is once you know you're dealing with a stable knee, the way this is done is as follows. You're going to take the proximal tibia and you're going to pull it towards you, the practitioner, while you take the distal tibia and you push it away. Since I have size, I use that to my advantage, and I do it like this, where I reach behind the lower leg, the upper part of the lower leg, and then I put my arm across the lower leg. And what I'm going to do is I'm going to traction the top and push on the bottom and hold that for about 10 seconds. It actually feels quite good. And then a little double clutch move to yank that forward, flex the knee a few times, clunk a little bit, and then in and retest the strength. It's amazing how that will change afterwards.